November is Lung Cancer Awareness Month. Did you know lung cancer causes more deaths in the U.S. than any other type of cancer in men or women? Here to bring awareness and to tell us about advanced treatment options are Doctors Romney and Dr. Rajesh Kukunoor from Ironwood Cancer Research Centers. Great to have both of you with us. I want to start with you, Dr. Romney. What can patients do to detect lung cancer early?
What a great question. You know, you'd mentioned that lung cancer is quite deadly, and it's because it's typically found in advanced stages. So if you can find it early, you can have more likely better outcomes. Folks who are smokers should start getting lung cancer screening when they turn the age of 50. And you can talk to your doctor about that individually, but it's an annual CT scan that's a low dose, so there's lower risk to it. And you find it early, you can have better treatment options.
Absolutely. Our symptoms, would we feel those symptoms? What are they?
You can, and it would include cough, coughing up blood, having shortness of breath or even chest pains, weakness, fatigue, weight loss. Those can all be signs, but typically of more advanced cancer.
Right, and Dr. Kukunoor, I understand survival rates for lung cancer, they are increasing and have continued to increase over the years. Can you talk about these advances?
Absolutely. So this brings us to the topic of what we call nowadays precision oncology, where cancer cells, researchers have found a lot of different targets inside cancer cells, different mutations, chromosomal abnormalities, to which they've been able to pair a particular treatment that targets that particular abnormality like a silver bullet. So the survival rates have improved significantly, and many of these treatments like immunotherapy and other targeted therapies, which are pills nowadays, as opposed to the traditional chemotherapies in the past, are tolerated very, very well.
Oh, that's amazing. And Dr. Romney, how is Ironwood treating early stage lung cancer, and what do you want patients to know?
Well, a lot of times with an early lung cancer, we do surgery, which is great with good outcomes, but most patients can't tolerate having half of their lung removed. And so doing precision radiation is an option for those folks, where we can target a tumor non-invasive with radiation and offer very similar cure rates and cancer control rates to surgery.
That's huge for people, because then it's not, you're not down so long as you would with some of the other previous treatment options.
Absolutely. Operating in the chest is a big deal.
Right.
And it can be life-altering surgery for some folks. And so this option is an excellent treatment option for the folks who qualify.
Yes, and I know Ironwood is advancing cancer care here in our community. Talk about the importance, Dr. Kukunoor, of clinical trials and how that plays in the survival rate.
Absolutely. So all our modern therapies in cancer or other specialties have come through clinical trials, so it's very important to try and encourage people, if available, to enroll on clinical trials. Ironwood has put a lot of resources into expanding our clinical trial program. We have a new director of clinical trials this year, and we're bringing a lot of trials, not just in lung cancer, but other cancers as well. And to piggyback on what Dr. Romney was talking about, when we treat early stage lung cancer with radiation, now we have a couple of clinical trials where the patients can even get immunotherapy after they finish the radiation to further improve their cure rates. So lots of exciting stuff happening in clinical trials, and Ironwood specifically participates only in phase 2 and phase 3 clinical trials. These are trials where drugs already have a track record, so nobody is getting a placebo.
That is huge, and I know a lot of people think, oh, I'm going to be a part of a trial, I get the placebo. Not happening.
Nope.
And if we want to be a part of a clinical trial, Dr. Romney, how do we go about that?
If you've been diagnosed with cancer and you have questions about clinical trials, you can visit our website or call our office. We'd be happy to see you and do a consultation to determine what you may or may not qualify for.
Right, this is huge in the lung cancer world. Thank you both for being with us. Incredible information. If you would like to learn more about lung cancer and your treatment options, Ironwood Cancer Research Centers, they have 10 Valley locations. To book an appointment, please call 480-821-2838, or you can visit the website ironwoodcrc.com.